So can a chiropractor fix a misaligned jaw? Well, as you know, it all depends on what the cause of the misalignment is. But in most cases, probably yes. Now, the thing is, most people don't even know they have a misaligned jaw. In fact, it might be your partner or your loved one that's sharing your bed with you who may often notice that you're grinding your teeth at night. Often it sounds a bit like snoring or something of that nature because it's quite a deep grinding sound. And most of us don't even know that we're doing this as well in our sleep. The reason a lot of us do grind our teeth is because of some sort of subconscious stress that we're holding, and it might be either psychological stress or even mechanical stress. In both scenarios though, that stress is manifested in a mechanical way, and if we're grinding, if you ever look at a horse for example, you can see they chew in one direction, and we do the same thing. We often favor one sort of direction of chewing. If that's really obvious, it's just the same way as like when you're carrying a bag one way more than the other because you're favoring it, you can have a misalignment in your body as well. Same thing with your jaw, you can have a misalignment there too. Now the thing is, it can have a knock-on effect. Now the jaw joint, the temporomandibular joint, the TMJ, that joint, okay, we've got one on each side, just in the front of our, or just sort of mid-cheek, just around that sort of region just there. And that's often where you can also get some aches and pains if you're overusing one than the other. And therefore, you've got your temporalis muscle that spans right up to the side of your head, just across there. So if you're getting extra tension or stress through that area, that can cause some of those headaches that you can get through that region. The question is, why are you favoring one side more than the other? Is it a normal favorement, or is there some other problem going on? And that we know as chiropractors and even osteopaths that there's a deep connection with some of the muscles around the back of the neck through there, some of the nerves that come through there as well. And so we will really examine that area and see what's going on through that area and the impact on the rest of the spine and the rest of the body too, and the nervous system around that area as well. So you can often look at that, so you can do some external techniques, so looking outside the body. However, there are some internal techniques, so sometimes, obviously wearing gloves, but you may even use the inside of the mouth to hold onto that jaw joint and in a very gentle, specific way, realign that joint if it has been dysfunctioning quite severely, and you can realign that jaw that way too. But all these things are great in the shorter term until you address the longer term lifestyle impact of things that are causing it, the factors that are really challenging that jaw joint from getting misaligned. And that's the key thing that's really important in a lot of these cases. We want to make sure that works better. What we do and what I do, I'm very lucky that my wife's a dentist, so we work together hand in hand in our clinic here. And so we'll talk about cases where we've had misalignments in patients. And often the thing is that I notice that most of the dental community and most of the dental profession will actually offer some sort of external type of or some sort of artificial thing like a mouthpiece or a splint or something of that nature to help try and realign that misalignment. But the thing is, that's just sort of fixing the symptoms, not fixing the actual problem that's causing that original misalignment as well. So I hope this found this useful. Please let me know if you or someone that you know is suffering with a misalignment. Let me know how you're dealing with it, and also know what kind of symptoms you're experiencing as well. How is it impacting your life? I'd love to hear from you. Thank you.